So the ELOCON-2 trial is a prospective randomized trial which compared lenalidomide and dexamethasone versus lenalidomide and dexamethasone and elotuzumab. Elotuzumab is a monoclonal antibody which is directed against FLAM F7, which is located in the surface of natural killer cells and in the surface of myeloma cells. So the mechanism of action of elotuzumab is considered to be a dual one. First of all, it is being attached to the SLAM F7 on NK cells and activates NK cells, and the other mechanism of action is that is being attached with the FLAM F7 on the myeloma cells, and this is a flagging for the NK cells to come, be connected with the complex, and then cause myeloma cell kill. In the ELOCON-2 trial, patients were included if they had at least one but no more than 3 prior lines of therapy. Patients who were pretreated with several agents. They could have been resistant to bortezomib. They should have some patients with few patients with exposure to lenalidomide were included as well, but they should not have been resistant to lenalidomide. So the patients were treated with lenalidomide given continuously with oral dexamethasone, and in the experimental arm, elotuzumab was added at a dose of 10 milligram per kilogram of body weight weekly for the first 2 weeks, and then every 2 weeks until there was evidence of disease progression. The two primary endpoints of the trial was progression-free survival and overall response rate, and in both of these endpoints there was an advantage of the combination of elotuzumab with lenalidomide and dexamethasone. There was a hazard ratio of 0.7 indicating that there was a 30% reduction of the risk of progression or death in favor of the elotuzumab combination with lenalidomide dexamethasone, and the response rate was improved from 77% in the combination arm, whereas it was 69% in the arm of lenalidomide and dexamethasone. So for both endpoints, the results were positive in favor of the investigational arm. Overall survival data are not yet mature, so there will be an update, and most likely they will be presented at ASH later this year. As far as side effects are concerned, there was no significant difference in the side effects between the two arms, and essentially the side effects were those which we expect and we see with the combination of lenalidomide and dexamethasone. Neutropenia, thrombocytopenia in a smaller percentage of patients, muscle cramps, some skin rash. So the addition of elotuzumab to lenalidomide and dexamethasone did not increase the complications. A forest plot analysis indicated that all subset of patients benefited from the combination of lenalidomide dexamethasone with elotuzumab, including patients with adverse high-risk cytogenetics, including older patients, including patients who were refractory to the most recent therapy. So there was an improvement across all subset of patients. From the ELOCON-2 trial, we may conclude that the addition of elotuzumab to lenalidomide and dexamethasone is the first prospective randomized trial which is testing in multiple myeloma the benefits of a monoclonal antibody added to standard therapy, and from this point of view it is a very innovative study, and it gives the opportunity for several patients with myeloma to receive a well-tolerated and more active treatment.